Hi everyone, Dr. Jeff with you this week with Coop Student Mya, and Maya's got a big topic this week, which is?
We are talking about TMJ, it's a mouthful, it's the temporal mandibular joint.
In other words, your jaw.
Otherwise known as your jaw.
So, your jaw is kind of a kiki joint. It really has a number of motions. If you think your shoulder moves all over the place, well, think your jaw, it drops, it moves, it does a whole bunch of things. It's actually called a hinge joint, or part of it's called a hinge joint. So part of it actually has to drop down and it kind of releases itself. And then that allows you to actually drop your jaw down and move it a little bit. You also have a disc in it. It's almost like a concave penny. What happens is the disc has to release itself. That allows your jaw to come forward and back. A lot of people get noises, they get clicky jaws. That's generally caused because either a muscle is really tight, one of your pterygoids is really tight, or quite often it's this disc is kind of trapped in there and you'll get a little popping noise. I know my wife loves eating dinner with me because quite often if I move my mouth too much, it kind of pops and drives her crazy. Doesn't hurt, it just drives her crazy.
Yeah, so there's a couple of different ways you can track this. The first way is trauma, and so that can be falling off your bike face first and landing face plant on the sidewalk. Another way that this can happen is if you get socked in the face by someone. Hopefully that's not happening to too many of you. So yeah, that would be kind of a trauma injury that would cause this. And then there's also overuse that will cause it. So some people might find that they chew on gum a lot, and chewing on one side of their mouth can cause a muscle imbalance. And also you can grind your teeth at night or kind of clench your jaw, and so that would be an overuse. And then lastly, you can also get arthritis in this area, but that's a little less common.
Yeah, you don't see that often. Anyways, as far as if you're having some jaw pain, it doesn't always cause jaw pain per se. Some people come in and complain about a sore jaw, but also people come in and complain about headaches. And sometimes you have to check your jaw for headaches, because 50% of headaches can come from your jaw. A lot of people come with really stiff neck and stiff shoulders. And when you clench your teeth at night, if you even practice clench your teeth, you can feel it all going down through here. But when you come in, we kind of do some tests for your jaw. We kind of feel it. We look at how it's moving. We do a number of tests for it, and that kind of gives us an idea of what's happening with your jaw. And then we have to figure out a treatment. So if it's something where it's like a trauma, where you have fallen, or you've been punched, or you bite in a big apple, we get that all the time. You bite in a big apple or real hard candy, and your jaw kind of locks, and you can't really open it or close it as much anymore. That's something where chiropractic manipulation will probably be the best thing for you. When we come in, we actually have to move it. We move it, push the disc back in, or we rehinge that jaw. If it's more muscular related, then that's something where we can actually, there are actually massage therapists out there that specialize in treating TMJ issues, or some dry needling will help with that. Also, sometimes acupuncture helps try and release some of the stress with it. But there's a number of different types of treatments we can do to help you on with this problem.
Okay, so there's obviously some ways that we want to prevent this from happening. I'll give you kind of two ways. The first way is exercises. So we can give you a couple of different exercises for your jaw to help strengthen the muscles around it and also just keep that joint mobile. And then you can also get mouth guards or bite plates to kind of prevent the clenching of your teeth at night and kind of putting stress on there.
Yeah, so if you're suffering from some jaw pain, one thing is to go see your dentist, and the dentist is going to be helpful as well, making sure there's no issues with your teeth that might be causing it, because that's certainly something we can help you with. So always check with your doctor about something like that. Also, he can prescribe you a mouth guard or a night guard, because he can actually look at your teeth and see if there's any grinding or anything going on. He can help you with that, with getting a night guard with it. But again, if it's something where it's out of alignment, it's clicking and popping, that's something that we can certainly help you with here. So if you have any questions about what we did today, you can always send this to us via an email or on our page here. If you like what we did, share with your friends. We always like shares, we like likes. And if you have anything you want to talk about, let us know. And here at Goals to the Wellness Center, we got your back.